Hello everyone, now let us discuss about CPC mock question from case studies. Coming to the question, the operative report indicates nephrectomy and the location is hospital inpatient. The preoperative diagnoses are perinephric cyst, right uretropelvic junction obstruction. And next is right hemorrhagic renal mass. And postoperative diagnoses are right perinephric cyst crossing the lower pole vessels and hemorrhagic posterior renal cyst. The procedures performed are exploration of right kidney, deroofing of perinephric cyst and partial nephrotomy for the removal of renal mass. So here two ICDs must be given. Cyst kidney, perinephric cyst and renal mass. And also partial nephrectomy has been performed for the removal of renal mass. Anesthesia is general anesthesia. Now coming to the procedure, the patient was given an epidural anesthetic and general endotracheal anesthetic. He was placed on the right flank position, secured to table flexed, a skinny rest elevated. The patient was secured to the table with tape and bean bag. A 10th rib incision was made, the tip of the 10th rib resected. Attempts to stay retroperitoneal were successful because of dense fibrosis of kidney to the retroperitoneal space. The peritoneum was then opened. Eventually, we mobilized and identified real helium. There were two sets of vessels. There were lower pole vessels that crossed in front of the renal pelvis and lower pole renal artery actually crossed in front of inferior vena cava. The upper pole vessels were in more standard position. Perinephric cyst was in posterior location. The kidney was mobilized, ureter identified, the perinephric cyst aspirated, and approximately 100 cc of clear straw colored fluid extracted and sent for cytological examination. The roof of the cyst was then excised to the edge of normal renal parenchyma. Inspection of the cyst cavity showed no obvious abnormality. The kidney was then further mobilized. The adrenal gland was dissected off the upper pole of the kidney using right angle clips and ligatures. In the posterior upper pole of the kidney was densely adherent to the retroperitoneal space and the diaphragm. Using electrocautery, this was then resected off. A small hole was made in the diaphragm which was subsequently closed with 2O vicryl after the lungs have been overinflated and the air is evacuated from the pleural space. So you can find here perinephric cyst has been aspirated and the roof of the cyst was excised. This is the continuation. Hemostasis of the kidney was assured. I decided not to close its pledges. Hemosteel was used and sprayed on the cut surface of the kidney, which was not actively bleeding. The perinephric fat was mobilized and sutured over this. Inspection of the retroperitoneum showed good hemostasis. There was a small bleeding vessel which appeared to be an aberrant vein from the adrenal gland, and this was identified clipped on both ends, that near to the renal and that near to the adrenal gland. Hemosil was also sprayed into retroperitoneal space and gel foam packs were placed over the top of this. The perinephric cyst cavity was filled with perinephric fat and this was secured with 2O-chromic. The kidney was then returned to the retroperitoneum. At this junction, there appeared to be no obvious obstruction to the UPJ. The patient has the stent in and it remained in good position. It was decided not to mobilize the UPJ and place it in front of the vessels. A 10 mm Jackson-Pratt drain was left to the perinephric space and a 7 mm Jackson-Pratt drain left around the renal helium near the perinephric cyst. These drains were brought through separate stab wounds in the right lower quadrant and sutured to the skin with 2O-proline. Abdominal wall was then closed in 3 layers with 1 vicryl. The skin was closed with surgical clips. Sponge and needle counts were reported correct. Now coming to the CPT, If you go for CPT index, you can find nephrectomy. We know that in our question, partial nephrectomy has been performed. So if you go for nephrectomy, under nephrectomy partial, the CPT is 50240. So if you go for the description of 50240, it indicates nephrectomy partial. So this is the correct CPT. Now coming to ICDs, there is a renal mass and perinephric cyst. Perinephric means nothing but cyst of kidney, acquired cyst of kidney. So coming to mass, under mass you need to go for renal mass. Renal means kidney. Under mass, for, you can find kidney. The code is N28.89. This is the complete code, N28.89. And if you go for cyst, under cyst you can find kidney. Under kidney you can find acquired. Both for kidney and acquired the code is same, N28.1. So these two are the ICDs, N28.89 and N28.1. Now, if we see the options, the pathology report later indicated intraoperative frozen session demonstrating benign tissue, fluid aspirate still pending. So what are the correct CPT and ICD 10cm codes for this scenario? The CPT is 50240 along with RT modifier to indicate right side. And the ICDs are N28.1 and N28.89. Here, the procedure performed was a partial nephrectomy. And the surgeon also opened and drained the fluid from the peripelvic cyst, which was sent to pathology. The roof of the cyst was then excised, but this is usually reported with 50290. But it is considered bundled into 50240. And modifier RT indicates procedure was performed on the right kidney. So the correct option is B, 50240 along with RT modifier, and the ICDs are N28.1 and N28.8. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.